A relatively new treatment for men struggling with enlarged prostates. It's now getting national attention. And some of the first tests for this were done right here in Jacksonville. Enlarged prostates are very common among men, especially as they get older. Harvard statistics show by age 60, half of all men will have an enlarged prostate. And more than 3 million men are diagnosed with it every single year. Let's bring in Dr. Ali Kazraian with Kazraian Urology, joining us live this morning. Thank you for coming in.
Thank you for having me.
This is very interesting because people are talking about it all across the country, but it has roots here in Jacksonville.
Yeah, this procedure that we're going to talk about today, we're very fortunate to be among the first cases in the country that were done outside of clinical trials, and now we've accrued about a 4-year experience and almost 100 patients that we've done this procedure called the aquablation or the aquatherapy, which is a very interesting, very minimally invasive taking care of BPH or an enlargement of the prostate, regardless of the size of the prostate, regardless of the shape of the prostate, and most patients go home the next day. As you see here in the video, you use the combination of an ultrasound, which looks from outside in to look at the measurements of the size of the prostate, and then that silver thing you see there is a cystoscope, which is a telescopic camera that goes in there, and it has associated with a water jet that can very precisely and very accurately, without heat or painful energy, open up the prostate and suction that out. So some people who have been delaying therapies because they're concerned about the potential side effects of more conventional therapies can take care of something that's probably been bothering them for a long time.
Yeah, and it's kind of hard to, for us non-medical people to see what exactly is happening here, but you and your team have done this successfully.
Absolutely. The way to think about BPH, which is benign prostatic hyperplasia, is think of your prostate as an orange. You got the outside rind of the fruit, which typically is where prostate cancer lives. The middle fruit portion does not contain cancer, but a lot of times grows, like you were mentioning before, in a large number of men to obstruct and put pressure on the urethra, so urination becomes difficult. What the typical procedures are like, the most classic one, the TURP, is going in with a spoon and carving out the fruit. Here, you're using a water jet to very precisely open up the portion of the prostate that you've used an ultrasound to plan very precisely, very accurately, and very reproducibly.
Yeah, so certainly you're being like a medical plumber.
Absolutely.
I mean, could you describe it as that?
Most urology is some form of plumbing of the human system.
All right. So let's talk about this. Let's look at the big picture here. What are the signs of an enlarged prostate? When should you go and talk to someone like you, a doctor?
Absolutely. So if you think about its urination issues, so if you think of that fruit of the orange or the middle portion of the prostate, that BPH blocking the urethra, you may have trouble with a weaker stream. You may feel like you're straining to push. You may actually feel like you're not emptying the bladder completely. Also, it may have effects on the bladder as it's filling. You may feel like you're going more frequently. You may get an urge to rush to the bathroom. And all of those things in combination can be related to your bladder's response to a prostate that's enlarged now.
Yeah, and there's some people that just typically write off those symptoms. They say, I don't need to deal with this. I'll worry about it later. I'm too busy.
A lot of people associate this with age, and they don't want to, they just assume and accept it. However, right now, very simple evaluations that we can do in the clinic setting to see what's going on very precisely, very accurately. And this treatment has been very, very successful with the aquablation aquatherapy to take care of prostates regardless of the size or the middle portion. This study that we were talking about is a 5-year experience for this, which shows that compared to more conventional standard of care therapies, you have better outcomes, continued outcomes that are maintained, lower retreatment rates, including use of medications, and patients' symptoms, like you were talking about, significantly improve. And also when we measure the force of their stream, it's much, much, much better, about 3 times better than it was before.
Yeah, much better quality of life.
Absolutely.
I mean, it's simple things like that just make your life a lot better.
Absolutely. The way you want to think about this is this will bother the majority of men at some component, and you don't have to be bothered by it. And now this minimally invasive therapy called aquablation doesn't use heat. It's very precise and accurate using robotic technology that the surgeon plans based on your very specific anatomy using an ultrasound and a look in the bladder. And that's very innovative and one of the unique parts of this procedure. And we're very lucky to be a part of it.
And finally, if people think that they might be a candidate for it, they reach out to their doctor. What do they need to ask, and is it going to be covered by insurance?
So Medicare covers this now, and so a majority of the commercial insurance pays. Some don't, but there's a whole team between us and the team at the company ProCept, the aquablation team, that tries to make sure that coverage is obtained when it's able to. Talk to your doctor about your urination issues, and one thing to think about this procedure, which sets it apart, the majority of the patients that undergo an aquablation, you can preserve external ejaculation. Some of the other therapies that you do for opening up that prostate channel significantly decrease the possibility of external ejaculation. And this, in that big 5-year study, almost 90% of people were able to maintain their erections. No incontinence issues, and most people went out of the hospital the next day.
All right. Dr. Ali Khosrayan, thank you so much for coming
my pleasure.
on. I appreciate it. I know we'll have you back on again soon.
I appreciate it. I look forward to it.
We'll be right back.